1 minute away. Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jean Lambrew from Maine's Department of Health and Human Services and Commissioner Pender Macon from Maine's Department of Education. Commissioner Macon, Commissioner Lambrew, and I are pleased to be able to join everyone this afternoon to provide you an update of where we stand with respect to COVID-19 for the entire state of Maine for today, Tuesday, February 16th, 2021. I'll start by providing an update on where we stand from a public health and epidemiology perspective, and then turn things over to Commissioner Lambrew to talk about testing and some other developments. Commissioner Macon, thank you so much for joining us to talk about and answer any questions around the education pieces. And I begin my updates today on a sad note. The Maine CDC is reporting 2 additional deaths today, one of whom was a resident of Kennebec County and the other a resident of York County. One was a woman and one was a man. One was in their 70s and the other was in their 80s. The passing of these 2 additional individuals brings the total number of deaths associated with COVID-19 in Maine to now 651. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of both of these individuals, as well as all of those who have passed away with COVID-19 over the past year. Overall, right now, there are 42,768 cases of COVID across the state, representing an increase of 91 cases since yesterday. Of those cases, 34,054 are confirmed, 8,714 are probable cases. Cumulatively, 1,487 people have been hospitalized, and just in the past 30 days, 174 people have been hospitalized. Right now in Maine, 92 people are in the hospital with COVID-19. 24 of them are in the ICU, and 11 of them are on a ventilator. In terms of our testing metrics, our positivity rate for PCR tests has continued to come down. It now stands at 1.57% on a 7-day basis. That's about where it was in early November of last year. Our PCR testing volume now stands at just under 600 per 100,000, 599 tests that are being conducted for every 100,000 people in Maine. Turning next to vaccines and vaccinations. Cumulatively, there have now been 249,913 doses of COVID-19 vaccine that have been administered across the state. Of those, 176,892 are first doses. And as of this morning, 73,021 people have received both doses of their COVID-19 vaccine. To put those numbers in percentage terms, as of this morning, just over 13% of people in Maine, more than 1 out of every 8 people in Maine, had gotten at least their first dose. And about 5.5% of people in Maine, about 1 out of every 20 people, have now been fully vaccinated, having received both of their doses of COVID-19 vaccine. And finally, one update before I turn things over to Commissioner Lambrew. Maine CDC recently received confirmation of the second case of the B117 variant, the variant that was first described in the UK. We've recently received confirmation of the second case of such a variant in Maine. The individual with this B117 variant is someone from York County who had a recent history of domestic travel. We've completed our investigation and have not found any evidence of any linkages or connections between this individual and the individual case that we reported last week in Franklin County. The second individual that we are reporting today is doing well and is continuing their period of isolation. As we talked about last week, Maine CDC has been actively searching for cases associated with this and other variants of COVID-19. We've been doing so in partnership with clinical laboratory partners, such as the Jackson Laboratory, as well as doing this testing at our own laboratory in the near future, as well as in partnership with the US CDC. Because we are actively looking for these cases, we expect to find more and more individual cases of not just this variant, but potentially other such variants as we go forward. We will keep everyone posted if and when we learn more about this particular case, as well as if we detect other examples of other variants here in Maine. So with that, Commissioner Lambrew, I'd like to turn things over to you next.
Thank you, Dr. Shaw. I am happy to announce that the Maine Department of Health and Human Services, in partnership with the Maine Department of Education, is offering new COVID-19 testing options for schools. This will strengthen the strategy that has effectively limited the virus transmission in school settings. The state has started to receive 250,000 BinaxNOW rapid antigen tests, which it will prioritize for use by schools, along with healthcare and long-term care settings. The tests are expected to arrive over the next 3 months and come in addition to the 25,000 BinaxNOW tests that remain from the state's initial distribution in 2020. The BinaxNOW rapid antigen tests can detect the coronavirus infection from a nasal swab sample in approximately 15 minutes. The test can support in-person learning by diagnosing COVID-19 in symptomatic individuals, as well as enabling regular testing of teachers, staff, and other close contacts of COVID-19 positive individuals. To date, more than 80 schools across the state of Maine have received these rapid tests. The Maine Department of Education, alongside the Maine CDC, will provide support and technical assistance to schools that wish to implement additional testing as a strategy to advance in-person learning. The department has also encouraged the Swab and Send sites that collect samples for the state's lab to prioritize school personnel and students who seek a diagnosis related to COVID-19. Expanding COVID-19 testing in schools will further protect the health of Maine's children, educators, and school staff, along with the broader communities. Maine's approach to school reopening and in-person learning is working. The rate of new cases of COVID-19 in school staff and students in Maine continues to be less than half of the statewide average. And as of February 11th, only 5% of Maine schools had open outbreaks, the largest of which was 10 cases. I want to thank Commissioner Macon and her team for her partnership and tireless work to advance education during this global pandemic. And with that, I'll turn it back over to Dr. Shaw for questions.
Great, thank you very much. Again, we will now turn to our colleagues in the media. Please, let me just go to the list here. And so we are going to turn the first question for the afternoon over to Lauren Healy from WGME.
Hi, Dr. Shaw. I have two questions for you. My first has to do with the decline that we're seeing in cases. Should Mainers feel optimistic about this trend, and do you expect it to continue?
Well, here's where we are. There are reasons for optimism on the horizon. The number of new cases has come down, and with it, the number of hospitalizations, as well as the number of new deaths every day. And the metrics that we look at bear this out, whether it's the positivity rate or the number of new positive results that are being reported. Those are encouraging, and I think they are reasons for optimism. At the same time, more and more vaccine shots are going into arms with each passing week. As we get more vaccines coming into the state, we're working with providers to get those into arms. Those are all reasons for optimism. The reason why my optimism is not unqualified is because of these new variants. What we've seen about the new variants is, number one, they're more contagious. And number two, recent data from the UK suggests that they have a higher risk of serious disease, meaning hospitalization and maybe even death. And so while I'm generally an optimistic person, in this particular situation, there are reasons to be cautious. And that's why it's really important that we don't let our guard down. We don't stop wearing masks. We don't start forgetting that COVID is something that's still with us, but rather that we double down on those things. We keep wearing masks. We keep enforcing physical, or keep recommending physical distancing and abiding by it. Keeping those things as low as possible, or keeping COVID rates as low as possible, will make the vaccine process even that much more effective. So it's difficult to know where we're going to go. There are reasons for optimism, but there are still reasons for concern.
Thank you. And my second question has to do with vaccinations. In the early days of the vaccine, Maine was among the best in getting shots into arms. But now, according to the New York Times, Maine is at the bottom half of states for percentage of people who've received both a single shot and 2 shots. So when it comes to vaccines distributed, the Times reports that Maine has distributed 65% of its vaccine supply. Only Alabama and Rhode Island have distributed fewer shots. So why did Maine fall so far, and what's preventing the state from doing better?
Yeah, I would also recommend taking a look at other sites. So, for example, one of the other trackers, one that's been put together by Bloomberg, notes that in terms of the number or the volume of shots per arm that are happening, Maine ranks among the very top states. We're up there with the very top performing states in terms of the velocity with which that we've been able to get existing shots into arms. Now, we've taken a look at the data that the US CDC has with respect to doses that we've received that are actually going out the door. I don't know that it's quite right. In fact, the commissioner and I were discussing some of these data just over the weekend. We don't think that it's being reported or captured accurately by the US CDC, which in turn is feeding into some of the other websites. So it doesn't square with what we're seeing. What we're seeing for the most part is doses are coming into the state. We are getting them to providers who are getting them into arms by the thousands per day. Those are the data that we're seeing, and that seems to be in accordance with what at least some of the other websites show as well.
Sure, and I'll just add 2 points. When you do, again, look at the different measures, that Bloomberg tracker shows Maine as 9th in the nation on the percent of population getting the second dose. So these numbers are a little bit all over the place. All that said, our job here is to ensure that there's accountability. So we are sending messages out to all of the providers who give vaccines for COVID-19 in Maine and working with them to understand what do they have on hand, how quickly are they moving it out, and developing performance metrics, because it is critical that every dose that comes into the state of Maine goes into an arm as soon as possible. So we are working on that as we speak.
Thank you.
Thanks, Warren. Let me turn it over to Patrick Whittle next.
Thank you very much. I have 2 things that are very different, so I'll ask them separately. So we learned recently that the state has recategorized every county in the educational sort of risk analysis system as green, which I believe it had not been the situation since the middle of October. If Commissioner Macon or anyone else would like to address this, it would be good to know what the state needs to do to keep it there, first of all, and also, is there any way to know? These are essentially recommendations. So, is there any way to know how many of the school districts in the state are operating at full capacity at this point?
So with respect to that first question, what can the state do to keep things going in this positive direction? The data that's used and the anecdote, the qualitative and quantitative data that's used in determining the color-coded risk levels are fully dependent on the health of the surrounding communities. And so every person who has been supporting us in keeping our schools as open as possible is wearing a mask and staying home when they're sick and keeping their social distance from one another. And that is what people really need to continue to do to support the healthy schools and the safe opening at green level. Regarding your second question, we don't have exactly the percentage right now because it changes really day to day. Right now, everybody, I believe, is on winter break. So right now, that's not happening. When we return in next week, we check in on a weekly basis with superintendents and with school leaders and with educators. And we're keeping tabs on how well people are able to open. Those who are in hybrid, it's simply because of the spacing, the physical distance, and the availability of square footage.
Okay, terrific. And also these new testing options, which Commissioner Landrieu spoke to a moment ago, those also play a role in this in the school piece. Is that a fair thing to say?
Yeah, and I'll just say one of the reasons why from the start the state has prioritized testing is because it can quickly identify people who have COVID-19, move those folks into isolation, ensure that they don't further spread the disease, and thus contain the spread of COVID-19. Going into the school settings, the more we can quickly again identify people with COVID-19, keep them home, keep the people who are close contacts tested, because one of the advantages that we now have, having done this in hospitals and healthcare settings, is if there is a teacher who has been a close contact of somebody else in the school with COVID-19, with regular testing, with these rapid tests, that teacher can find out if they can be back in school. And if they test negative, they can be in classrooms rather than quarantining. That's a strategy we've used in long-term care settings and hospitals to keep those sites staffed safely during the pandemic. And it's a new strategy that we're now bringing to schools. Got
it. Here comes a sticky question. We are coming up on March, which means Maple Syrup Sunday is on the horizon. Is it possible we're going to be able to do this year? I feel like I speak for the whole state when I ask that.
It's a sticky question, Nirav. Do you want to take that one?
It is a sticky question indeed. It's hard to say, Patrick. Things are improving, and that's encouraging. But the worrywart in me is concerned that that events like that, even though they may be somewhat more solitary, there's still inevitable congregations that can happen. We've seen what can happen after other celebrations going from November and December. I think this for me is more of a wait and see. As optimistic as I am, because I know how sweet this holiday is for so many people. I think caution is still the watchword.
In part because it's possible that March could, for all intents and purposes, look pretty similar to February.
It could. Well, I mean, here we are. February is changing quite rapidly. It depends on which part of February. The top part of February still had high case counts. They've come down now. The variants that have been experienced in other countries, namely data from the UK and Ireland, suggest that they can spread quite quickly with a high degree of intensity. I think for me, Patrick, it's more of a wait and see.
Got it. Thank you so much.
Yep. Let me turn to Jackie Mundry from News Center next.
Hi, Dr. Shaw. Thank you. I have a couple vaccine-related questions. First one, as far as DHHS child protective case workers, we've gotten quite a few emails from folks who are really hoping to get a vaccine, and they were considered essential workers at the start of the pandemic and go just about everywhere police officers go, on these case calls sometimes. And they're just wondering, why they're not being listed in the essential worker category, and if there's still potential for them to get vaccines soon.
Sure. I'll address that question in part because those child protective services workers work for us here at the Department of Health and Human Services. We can't begin to thank those folks enough for doing what has been extraordinary work of keeping children safe during this pandemic in extraordinary circumstances. So that workforce is just invaluable to the state of Maine. For now, Maine does continue to prioritize its extremely limited vaccine supply to those who are age 70 and older, because the data do demonstrate that those are the individuals most at risk of suffering and most at risk of dying as a result of contracting COVID-19. To date, Maine has vaccinated 43% of Maine people who are age 70 and older. Following the vaccination of those individuals, Maine plans to turn to people ages 65 to 69, again because of elevated risk of death. As Governor Mills has repeatedly said, our goal with our vaccine supply right now is to save people's lives. We do value these workers as well as teachers and many of the other people who do provide critical services for the state. As Governor Mills is fond of saying, they're all essential. We are hopeful that the inadequate supply that we have today will soon open up, in which case we will rapidly be prepared to vaccinate all those individuals.
Thank you, Commissioner Lambrou. And then as far as nursing homes and assisted living facilities, have all of those residents at least gotten their first dose of vaccines yet?
I don't want to be as definitive to say all, but based on the data that we have received, there are, again, two categories to that program. There are skilled nursing facilities, and then there are assisted living type facilities. Based on the data that we have received, a very, very high percentage, close to all, have at least experienced their first administration clinic. In fact, for the skilled nursing, it's most all of them. And as for the assisted living, again, virtually all of them have had their first shot or their first clinic, with the second and third ones being scheduled. We are now thinking about where we go from here with other individuals who are in similar such situations. But again, Jackie, I don't want to say it's absolutely all, but because there might be one or two that weren't able to get vaccinated on that day, for example, but it's very, very, very close to all.
And Dr. Shaw, I'm wondering if you might be able to comment on a story we had last night about the reporting system for folks who have already gotten the vaccine. It looks like back on Thursday, sorry, I'm just reading my notes here. In the Thursday briefing, you said that hospitals were required to report all the adverse reactions of the vaccine. However, some hospital officials we spoke to said they referenced the VAERS website, which outlines that only most severe cases are required to be reported. We're just wondering if there was any sort of disconnect there.
Whether there was any what, Jackie?
Any sort of disconnect, should all be reporting?
No, there's no disconnect. VAERS is designed to capture serious adverse events. The definition of serious, it varies based on the type of vaccine we're talking about. For the COVID vaccines, it generally involves, for example, anaphylaxis or something of that nature. And hospitals, or really it's the provider that has the obligation to make that report. They've been doing so in Maine. And so this is a situation where I think it's really important to just take a step back and think about the data, or take a look at the data. Based on the analysis that the US CDC has done, serious adverse reactions to any of these vaccines are vanishingly rare. They're on the order of single digits per million doses that are administered. So these vaccines are not only among the safest vaccines that have been produced in recent memory, they also happen to be one of the most effective vaccines. In the rare events where there have been adverse events associated with them, first of all, those usually crop up in the first 15, if not 30 minutes during that observation period, where folks are asked to wait just to make sure they're okay. And in the instances that we are aware of where there has been a bona fide serious adverse event, to the extent that folks have notified us, they are also notifying VAERS as well. So I think folks should have confidence that there is a system in place to monitor themselves for adverse events during the observation period, and that if an adverse event like that happens, it will be appropriately reported to the US CDC, and that after having compiled those reports, the US CDC has come to the opinion that such events are extremely, extremely rare.
Thank you. And then I just have one more. How have the Walmart and Sam's Club allocations helped Maine's demand for the vaccine? Is it making any dent? And if so, how much?
Jackie, you cut out a little bit, but I think your question is, how have things been going with Walmart?
Yep. And then has that helped at all with the demand for the vaccine?
Got it. So the things have been going well overall, it has. I think it has helped with demand, and it certainly helped with supply. So let's recap. One of the reasons that we chose to work with Walmart for this first round of commercial partners is the geographic distribution of Walmarts. Walmarts are in different corners of the state, and they're also in parts of the state that we know that there are challenges with access. So Walmart was able to come in and play a needed role there to make sure that folks who live in those parts of the state have access to the vaccine. We've also seen that demand for the vaccine at all Walmart stores has been quite high, based on reports that I've seen or experiences that folks have tried to get vaccine. They've been able to, but they've also found that slots when they were opened up, were taken pretty quickly. So that's just evidence of continued demand. We're hoping to continue working not just with Walmart, but other commercial pharmacy partners that are known and trusted across the state to make vaccine even more available in different parts of the state.
Thanks so much.
Let me turn now to Eric Russell from the Press Herald.
Thank you, Dr. Shaw, Commissioner Lambrew, and Commissioner Macon. A couple of questions. One was a quick question. There was a call today with governors about maybe some disruption in the vaccine supply because of the weather. Do you know whether Maine is going to be affected by that?
Eric, we talked about that this morning with our internal team, but we don't believe that we will. We indicated to Operation Warp Speed last week that we wanted our vaccines delivered on Monday. Even though it was a federal holiday, we wanted to get ahead of any storm conditions. Because we did so, most of the doses were delivered yesterday. And so far as we are aware, the storm conditions elsewhere in the country, as well as in Maine, haven't affected the receipt of vaccines in the state. There may be, as we go through the day, there may be one or two instances where something was delayed, but it wasn't systematic in the way that it was, say, in the southern part of the country.
Okay. And it appears that the Biden administration has increased the shipment of doses to states to about 13.5 million, which would be, I think, if my calculation is right, about 2 million more than this week and the last week before that. I know you're still maybe a couple of days before placing your order, but is Maine under the assumption that we're going to get several thousand more doses, perhaps?
We are hopeful. We have received some preliminary estimates. They are just estimates about what we will be getting. We get those. They appear on our monitors in the dashboard that we share. We then work to confirm them with Operation Warp Speed. We are hopeful that after we confirm them, we may be seeing additional vaccine coming into Maine next week. How much? I just want to make sure we've confirmed it. But Eric, one thing I do want to note, there is a change, an arithmetic change that will be happening effective next week with the Pfizer doses. Recall that since the very first week, there was this extra hidden sixth dose in each of the Pfizer vials, sort of a heavy pour in each of the vials. That, even though that existed, it wasn't really accounted for. We were getting 975 doses from every tray of Pfizer on paper, but in practice, we're getting closer to 1,170, 20% more. Next week, the federal government will be changing its accounting practices so that each tray of Pfizer will more accurately show what is contained therein. The physical volume of vaccine will not be changing per tray, but as an accounting matter, it will more accurately display what is actually being delivered. So there'll be a 20% increase without any actual change in the volume. What we are looking at is what we get above and beyond that 20% increase.
Got it. And one question for Commissioner Macon, if I could. There's a big discussion that's happening both in Maine and across the country about schools and when to open and how to open. And I know that Maine has been pretty cautious, and a lot of schools have been a hybrid model because of what you said earlier about spacing issues and some staffing issues, I'm sure too. Is there any thought or possibility that schools would be able to reopen in some fashion full time before this year is over? Or is it more than likely that, there's focus, that focus is shifting to the fall?
So again, it is really, it's the distancing, the social distancing that's preventing full opening for most schools in the state. And I don't think we are at a place where we're ready to reduce that that requirement of schools for safety reasons. And that's what we're hearing from our colleagues at CDC and DHHS, that is likely to remain one of the key strategies to keep everybody safe likely through the spring.
Do you have some disconnect between some schools that want to do a 6-foot distance and some that want to do the 3-foot distance? I know that depending on which school they are, some adopt the 6-foot rule and some adopt the 3-foot rule.
Yep, they do. And that's determined locally. And
Okay.
much of it has to do with the population in a particular school or region and the age of their buildings, the size of their classrooms. And there are many factors that contribute to that difference between the 3 and 6 feet.
Thank you all.
I would just add though on that difference, when we were working with the Department of Education on their requirements and recommendations, we did read carefully the American Academy of Pediatricians guidance on this that said it could be done safely with 3 feet. That group did review the evidence from the fall and repeated that is a safe distance in their view with a review of the evidence from the fall. And our own Maine chapter of the American Academy of Pediatricians agreed. So we do believe that is a safe option for schools, which is why it's part of our recommendations.
Thank you.
Let me turn over to Amy Brown next.
Thank you, Dr. Shaw. I have a question for you and one for Commissioner Lambrou. First for you, last week when you reported on the person in Franklin County that was the first person in which the UK variant was detected, I believe you mentioned that there were some family members who had COVID as well. So when you talk about the case in York County being the second case, is that were the other family members of the original case in Franklin County not tested, or are you just talking about like a second episode of the variant being detected?
At this time, Amy, there is no evidence of any epidemiological linkage between the case we reported last week and the case that I'm reporting this morning or this afternoon.
But the family members of the original person who in Franklin County also had COVID, I believe you reported last week.
That is correct.
So is it not known if those folks also have the UK variant, which would make the person in York County not be like the second person in line? They'd be whatever number.
Sure.
Depending on how many family members there are.
Well, I'm not going to go into individual cases, Amy, other than to say there is no connection between the case in Franklin County and that we are aware of. There's no evidence of any connection between the case in Franklin County and the case in York County.
Okay, let me try to reframe this. How many people in Franklin County have the UK variant connected with that one, the one person that's known?
Just the one that we reported last week.
Okay, great. Thank you. Commissioner Lambrou, when you say 43% of the people 70 and older have been vaccinated, does that number include people who've received just one vaccine, or did I misunderstand you?
It is just the first dose. So
Okay.
when we look at our first doses, yes.
Okay, great. And then last week, the number was 30%. So at 13% increase week over week, are you thinking in about a month you'll be ready to move on to the people 65 and older?
Yeah, so we are not yet moving off of the 70-year-old and older group yet. We want to make sure that we have not just gotten the majority of those individuals, but also those who are hard to reach, because we do know that some people live in remote parts of Maine or have challenges getting to the vaccine site. So we will continue our effort to prioritize those most vulnerable people in Maine who are those ages 70 and older. We remain hopeful that in the coming weeks, we can then turn with increased supply to people ages 65 to 69, but we are not ready to announce that yet.
Okay, thank you.
Thanks, Amy. Let me turn to Brian Sullivan next.
Thank you, Dr. Shaw. I would like to hear from Commissioner Macon about, there's been a lot of talk about the vaccination of teachers and just what she's hearing from people in education in the state about how they're feeling and if there's been a press for that and if she's been advocating for that to whoever makes these decisions. I would assume some of the people on this call.
So I guess I would start by saying that our plan in the state of Maine prioritizes those who are at highest risk of death or hospitalization, serious illness. And when I ask teachers what they mean about wanting to be prioritized, I always, when we explain that this is where we're at right now, we're working on those who are 70 and older, and it will take us a considerable amount of time to get through that group of people. All educators I've spoken to have said they completely understand that. And I think they, like everybody else in the state of Maine, have questions about when might be the time or my turn somewhere in the lineup. But I do know that it's going to, unless we get a much bigger supply of the vaccine, I think it's going to take several months before we're able to move through those who are at the highest risk of the greatest harm should they contract.
And for Dr. Shaw or Commissioner Lambrou, as you do start to make those decisions and expand who can get the vaccine with maybe not age-based decisions, and you start rolling into some professions, how are those decisions going to be made, and where do you see prioritizing people in certain lines of work beyond who are already being prioritized?
Brian, as I think your question sort of hinted at, making those distinctions is extremely difficult. Commissioner Lambrou noted earlier, the governor herself has suggested, or at least noted that when you start talking about essential workers, well, all workers are essential, and so how do we go in between those categories and draw and make cuts and draw lines around? It's extremely challenging. Generally speaking, our approach thus far has been to focus on risk, the risk of serious disease, the risk of serious consequences from COVID, or the risk of death. And that's why we focused on, right now, those 70 and older. But when we think about it, when we're talking about workers, be they frontline, however that's defined, or essential, however that's defined, I think risk will continue to be a part of it, but there are other elements that go into it, as the US CDC has recommended. I don't think at this time we've made any final decisions or constructed an algorithm or something like that that will tell us these things. As with so many things COVID related, it will be a mixture of factors. Some of them are strictly quantitative, numerical based. Some of them are qualitative, like how they interact with others and their degree of risk. I don't think there's going to be a formula that will tell us how those lines are drawn. It will be a series of discussions.
Okay. And just real quick, how's the system coming? The registration and the phone line?
Somehow I thought you were going to ask, Brian, so I appreciate you checking in on this. We are still working our way toward it. Part of it is making sure that all the contractual and administrative pieces are ready to go. But the other element that's underway right now, or that's being worked on this week, is now it's all well and good for us to have a call center and a scheduling platform. We now have to make sure we're connecting with providers who will use it, so they know how to register the site that they are hoping to stand up to make it available on the list of places where people can go. Those providers know how to access those names of folks who sign up. So those are the discussions that we're having this week, so that providers, when they are ready to use it, know how to do so. We're still a ways away from having it online, but keep checking in, Brian.
Okay, thank you. Solid haircut. Have a good day.
Thank you. Thank you. Let me turn it over to Megan at WMTW.
Thank you for taking my question. I think it's probably aimed at Commissioner Macon and Commissioner Lambrou, but Dr. Shaw, I'd love to hear what you have to say as well. But talking about these rapid tests, are they going to be used proactively or reactively? Because I know that school systems that have them now use them in the event of symptoms. So is the intent that you will be testing now more on a daily basis, every few days, just everybody, or are we going to be continuing to do it if there are symptoms, or is it up to the district? Also, is this also, we've heard from a number of teachers, as you've talked about, that the vaccine would be really the only way that some of them or many of them would feel comfortable getting back into the classroom full time. So in your conversations with educators, Commissioner Macon, would these rapid tests be enough to kind of increase confidence to be in the classroom with more students at that time?
Why don't I quickly answer the first one, and then Commissioner Macon, you can answer the second. I think the answer is both. We are excited about the fact that we can use these BinaxNOW rapid antigen tests for both to testing people with symptoms who are in schools, children, staff, teachers, or in the case of a teacher or staff person who is a close contact of somebody with COVID-19, without whom that school couldn't remain open, you can serially, maybe every day or every other day, use that BinaxNOW test for that person so they can stay in the classroom. It is a tool that we've, again, proven in hospitals and long-term care settings can keep staff in schools and thus keep students in schools. So it is an exciting breakthrough that we're hoping that schools will take advantage of.
And sure, thank you so much. We're incredibly grateful, by the way, to our colleagues at CDC and DHHS for making this available to us. And we recognize that as meager resources come to our state, there are some very hard decisions to be made, and we're very grateful that schools are prioritized at this time. When we opened schools in the fall, we opened prior to there even being a hope of a vaccine this year, frankly. We opened without thinking we were going to have the capacity to do any testing whatsoever in schools. And so we created, with the full participation of CDC and DHHS, a layered strategy. Not one of those strategies in and of itself would provide 100% of the protection and security and safety that we would want. But the more layers that were added to those strategies, the safer and healthier our schools have been able to remain. We realize that it has been working. We're doing better here in Maine and across New England, frankly, than the rest of the nation. And I think there's a little validation in the fact that the US CDC's new guidance is very much a reflection of the layered strategies that we have been using here in Maine to keep everybody safe. This new addition of expanded testing availability is going to only increase as another layer of safety and health for our students and staff. And I do believe people will recognize that this is adding to what we had in place already.
And Dr. Shaw, if I could just follow up quickly, obviously the vaccine would be probably the best defense and probably better than testing, rapid testing. But can you compare the two in terms of being in that kind of classroom environment and how safe is doing rapid testing versus the vaccine?
Megan, I think what the experience in Maine has shown is that we can do in-classroom, in-person education safely by adhering to the guidelines that our groups have put forth, things like mask wearing, distancing, hand hygiene. School in person can be a safe experience. So your question sort of asks, what are the relative benefits of vaccination versus the widespread or more widespread use of testing that we're recommending? Both of them are aimed at the same goal, which is stopping the spread of the virus. If someone were exposed, making sure that their level of virus is not sufficiently high so they can safely be in the classroom. On that regard, testing is really helpful. By testing folks what's called in a serial basis, maybe every day, maybe a few times per week, by testing someone who's been exposed, we can know the day that they show up to be in the classroom, whether they have a high level of virus in their body. If they do, then they have to go back home. But if they don't, we know from scores of studies, as well as our own experience in Maine, that that person can continue to be in the classroom. The test, in a sense, functions as if it were a vaccine because it allows people to be in the classroom without having an increased risk of spreading COVID-19 around. So this testing, this adjunct to being in the classroom is a step forward for educators, parents, and students across the state. The final thing I'll say, Megan, is that the director of the US CDC, Dr. Walensky herself has noted that, of course, it's desirable that we vaccinate everyone in the state, but vaccination, in her words, is not a prerequisite to in-classroom education. The data that we've seen in Maine bear that out as well.
Okay, thank you.
Let me turn next to Evan Pop.
Hi, Dr. Shaw. Thank you. With Maine being a large and rural state, have concerns over people having access to transportation to a vaccine clinic been brought up? Yeah, as I understand it, those covered under Maine Care have access to that program's non-emergency transportation services. But for those not covered under that program, if they don't have access to a vehicle or another ride, what are the options there?
I'll just add that we are working aggressively on that. We appreciate the fact that this is a major challenge, especially in rural Maine, but also in parts of urban Maine where some of our clinics are not on a public bus route, for example. So we are working aggressively on that. We also are working with our AAAs, our area agencies on aging, that are also helping drive people to these sites, but we're hoping to have more to announce on that soon.
I'll just say, Evan, generally speaking, there are two ways that we are approaching this concern, which you are correct to note. One is to work to bring folks to sites of vaccination, like Commissioner Lambrou noted. But as vaccine supply increases, we will also bring more vaccines to folks. That is to say, by being able to expand the locations at which individuals can be vaccinated. Our work with Walmart was one step in that direction, but we're not stopping there. We know that there are other ways to increase access to vaccine in harder to reach areas, whether they are rural or in some cases in urban environments as well, where transportation can be a challenge. As we get more vaccine, we can not only provide existing sites with more vaccine, but also stand up new locations as well.
Thank you.
Let me turn next to Ann Burlean from the Ellsworth American. Ann? All right, we're going to come back to Ann after we check in with Caitlin Andrews.
Hey, good afternoon, everybody. Thank you for taking my question. So the state has a contract through its EMS service for Block It Now for EMS vaccine scheduling services. And that contract notes that the service seems to be a temporary measure while the state works on a system from PrepMod or Schedulo. Can you confirm if these are the software systems Maine is using to build its scheduling system and if it will take 6 months to complete it?
Well, it certainly won't take 6 months. And as to the former contract that you mentioned, I'll have to check. I don't know that we have activated that. If it's the same one I'm thinking about, I believe some other states had explored it but found it wanting. So I can check on that contract, the former one that you mentioned, the Block It, but I don't think it was found to be, it was part of a larger contract for a number of other sites. I believe that was, the Block It was a temporary solution that Maine EMS brought online because Maine EMS providers and clinicians are already out there scheduling, but they fully intend, based on a meeting I just literally had a couple of hours ago with the director of Maine EMS, once the larger scheduling system is brought on by the state, they intend to shift over to that.
Right, the contract makes it seem like it's a temporary 6-month fix until the PrepMod or Schedulo tool is ready to use. Taking a look at it right now. So can you confirm for me if those two systems are what the state is looking to use?
I can't confirm that until the contracts are signed. I can't confirm either of those until everything is done.
Okay. And my second question is, will independent pharmacies have a role to play in vaccinating older Mainers once they're finished working with long-term care facilities?
Yes, and I'm glad you noted that, Caitlin. It's important to note that independent pharmacies have already played a significant role in vaccinating older Maine people through their work with us, vaccinating folks across different long-term care facilities. We met with them last week to talk about where we go from here, because there are a number of other facilities across the state of Maine, some of which are classified as independent living, which house a high number of older Mainers, but others that they may not be classified as independent living. They may be different forms of housing that house folks that are at risk in different ways as well. We're working with independent pharmacies to map out where they are, what their areas of service are, and then how we can activate them going forward. They have shown a great willingness to continue partnering with us, and we're looking forward to continuing to work with them.
Thank you.
Let me turn back to Ann at the Ellsworth American.
Thank you, Dr. Shaw. I apologize for not being ready before. I have two questions that are directed at Commissioners Lambrou and Macon. The first is about the mental health of our students. With large numbers of children and adolescents reporting sometimes extreme mental health issues under COVID restrictions, including remote learning, is there any effort underway to quantify this data for Maine youth?
What we do know is that this is a very concerning trend. We are seeing that a lot of kids are feeling isolated and disconnected and are experiencing increased anxiety and stress, all predictable, unfortunate byproducts of, I think, some of the isolation that they're experiencing. What we've done at the Department of Education is that we've stood up an online open source SEL for me. It's called Social Emotional Learning modules that students and families could access from home. It's free, it's open source. We also have a team at the department providing real-time office hours and consultation for schools and youth serving organizations across the state who are looking to increase their capacity to support kids. We also have a triage team that supports schools when they are in a really concerning situation.
Yeah, and our Office of Behavioral Health continues to run a program called Strengthen Me. You can find that online. It provides a range of resources for people of all ages and different types of positions, including teachers, for example, who are dealing with some of the stress themselves. It is free assistance targeted to people, including youth, to try to provide them with the information, the connections, the local people who can help them out. We take very seriously the challenges of mental health and substance use disorder during this pandemic and continue to do all that we can to provide those resources. People can always also call 211 for assistance.
Thank you. Both of you actually answered my second question, which is what measures might be taken. My question was if there's any effort or plans to quantify this data of how many Maine students from K through 12 are experiencing and have been adversely affected through mental health issues by the restrictions.
I don't think we have a statewide effort to quantify how many students are experiencing distress in that way. However, we have provided for schools the capacity, and they have on their own, in fact, and are working to identify this within the local school system, which students are in need of support, are failing to engage. And again, but no, we don't have a statewide effort to count all of those students who are experiencing.
And Maine CDC does have annual surveys that do pick up on, suicidal intentions, substance use disorder, other stressors. So I think we'll pick up some of that when that survey comes out. And I should just note that that website I referred to is strengthenme.gov. We do refer everybody who is looking for information to that site. Thank you.
Thank you.
Thanks, Ann. And the last question for the afternoon goes to Charlie from Maine Public.
Yeah, hi, Dr. Shaw. Thank you. So now that Maine CDC has identified the 2 cases of the B117 variant, how does that, and the fact that they're in different parts of the state and people with no clear connection to one another, what does that tell you, if anything, about how it's spreading in Maine or getting here?
Mm-hmm. So in this instance, thanks, Charlie. In this particular instance, where we are right now, we have identified the travel linkages for both of these individual cases, the one in Franklin County and the one in York County, where we believe it is likely they acquired. In Franklin County, it was international travel. In York County, domestic travel, and travel during a time period which that matches up with their symptom onset as well as their other epidemiological factors. So we are not in a situation, thankfully, right now, where we have detected the variant, but in an individual with no travel history. That being said, that has occurred in other states. Not long ago, I read a report from South Carolina, which had detected a variant from another part of the world in an individual who had no history of travel whatsoever. That is a possibility. Maybe not from either of these two cases, because we were able to work with them and make sure that they were isolating or quarantining quickly. But it is the concern that's out there on the horizon, that eventually these variants will gain a foothold and start transmitting or being passed from person to person to person, such that we are not able to determine whether there was any linkage. Notice, Charlie, that's essentially the position that we were in back in March of last year, where we were starting to find people with COVID who had no history of exposure to anyone else with COVID. Now we are replaying that same tape, this time with the variants. It's concerning because, as I mentioned at the top of the briefing, these variants have a higher likelihood of being contagious, as well as potentially a higher likelihood of causing severe disease. Everything we can do right now to vaccinate folks, to continue wearing masks, to continue engaging in distancing will help keep these variants at bay. The variants can't spread if we don't give them an opportunity to, but it's a risk, it's a concern. It's one of the reasons for my caution right now, because they are out there and I don't want them to start spreading.
Great, thank you. And my second question is about, are you aware of any health threats in Maine, not the coronavirus, but other issues that have been getting worse somehow during the pandemic, maybe because people can't get health care or some other reason? And are there any that are particularly troubling you?
I've seen some data that have been cause for concern, namely well, sorry, you know what, Charlie, I should be more careful. I have seen some data, and then I have heard some anecdotal reports. Let me start with the data that we've seen, which is earlier in the pandemic. I don't know if it holds true now, and we can check to update what I'm about to say, Charlie. So before you go to the bank with it, let me do a little bit of digging. But earlier on in the pandemic, there was a concerning decrease in the number of adolescents who had been up to date with their vaccine. We undertook efforts to get those adolescents back on track. I actually want to check with our immunization team to see whether those efforts bore fruit or whether we are still seeing adolescents in Maine being a little bit behind. So we'll check on that and see where we are. That's some data. We've also received anecdotal reports as well as some other data to suggest that because of the pandemic, a certain number of medical procedures had been foregone or put on hold, things like bypass surgeries, things of that nature. Again, I want to just take a look at the data to see where that stands. But those are at least two examples of concerning issues. You mentioned earlier, or sorry, Ann Berlian's question noted a concerning increase in mental health concerns. That's certainly out there as well. And then finally, although we're talking about things that have gotten worse, it's important to note that there have been at least one silver lining, which is the rock bottom number of flu cases.
Great, thanks a lot.
I will just add one that we're tracking, which is there's been an increase in overdose deaths from drugs. And so we are quite focused on how do we make sure we're providing naloxone when it's available, giving training for people to make sure that in this time, people are not using drugs alone, which is what's happening a lot. People are not there to call 911 or help those individuals. So given the governor's focus on opioid use disorders, we are stepping up a lot of our activity to make sure that we are tackling the increase in drug overdose deaths.
Okay, thanks.
A lot of these issues, Charlie, have their roots around things like insurance coverage. And so before we leave for the afternoon, I'm going to turn things over to Commissioner Lambrou to talk about one important thing with respect to health insurance coverage.
Yeah, we do have some good news to report. Starting yesterday, health coverage options are newly available under a special enrollment period due to the COVID-19 public health emergency. Maine people can sign up for affordable private health plans through healthcare.gov or the health insurance marketplace. 60% of Maine healthcare.gov enrollees can qualify for a plan that costs for under $75 per month. And even if you don't expect to need coverage this year, it's worth signing up now to make sure you have it in case you have an unexpected illness, a doctor's visit, if you need that mental health care that we just spoke about, or you need to fill a prescription. This pandemic has highlighted more than ever the importance of health insurance coverage. Information is available on this option at coverme.gov, or you can call 1-800-965-7476 for free local help. You can sign up for this private coverage through May 15th and also for Medicaid or Maine Care at any time of the year. Again, healthcare coverage could not be more important than it is now. You have a new chance to sign up for health insurance coverage. Visit coverme.gov. Thank you.
Great. Thank you, Commissioner Lambrou. And Commissioner Macon, thank you so much for joining us this afternoon. And thank all of you for tuning in to hear where we stand as a state. We look forward to catching up with everyone again on Thursday. Until then, as always, please be kind and take care of one another. We'll talk soon.